Alright guys, so we're talking about the boundaries of the Hesselbach triangle. The Hesselbach triangle has three boundaries because it looks like this. This is the way the Hesselbach triangle looks. Okay? The Hesselbach triangle looks like this. So this here is the inguinal ligament. That's this one is the inguinal ligament. And this one here, alright, is the lateral border. Here is the lateral border of the rectus sheath or the rectus abdominis muscle, and this here is the inferior epigastric artery. See, so this is the Hesselbach triangle on the left side. There's the Hesselbach triangle. Now this is the Hesselbach triangle on the right side. So this being the inguinal ligament, all right, this one here being the lateral margin of the rectus sheath, and this is the inferior epigastric artery. So that forms the Hesselbach triangle. The Hesselbach triangle is an important landmark in anatomy, in surgery, especially in inguinal hernia. The next we're going to be talking about now is inguinal hernia. Excuse me. Let us talk a little bit about the inguinal hernia. The inguinal hernia is found in the inguinal region. Now, the inguinal region is a small region anatomically that is found at the lower abdominal region. It is found at the lower abdominal region. It is also called the groin, Groin, and it extends between the anterior superior iliac spine. I'm going to use this as well. It extends between, so this is the anterior superior iliac spine. Those are the anterior superior iliac spine of your pelvic bone. All right. It extends between the anterior superior iliac spine and the pubic tubercle. And this is the pubic tubercle here. So this region here, all right, that region here, this region here that runs from between the anterior superior iliac spine and run all the way here to the pubic tubercle here, this is the inguinal region. And it's in the front. That's the inguinal region. And I'm sure you all understand that. It's clear. Look at that. It's very, very distinct. It's a small region, anatomical region, and it's very, very distinct. Okay? That's the inguinal region. Good. Now, the inguinal region has an important structure as far as the male reproductive system is concerned. And I'm going to reiterate this. The male reproductive system is useless without the testicles. The male reproductive system is useless. And come on, everybody knows that. Without a testicle, who are you? You're not a man if you're castrated. Now, embryologically, the testicles as well as the ovaries, they were somewhere hidden retroperitoneally. And I'm sure you all know what that means. It means that this is what I mean by retroperitoneal. This is the peritoneal membrane, or I would say the parietal peritoneum. This is the visceral peritoneum. And between the visceral peritoneum and the parietal peritoneum is a peritoneal cavity. Make sense? Right? Now here is an organ. This is an organ. Okay? This is, my hand is an organ covered completely by the peritoneal membrane. That is an intraperitoneal structure because it is covered completely. All right? It is covered completely. Look at that. It's swallowed completely by. So this pencil is wrapped completely by this layer of visceral peritoneum. So that's an intraperitoneal structure. However, some structures are just not covered by peritoneum completely. They are subperitoneal structures or retroperitoneal structure or extraperitoneal structures. The kidney is an example of that. So the testicles are with the kidneys at approximately 12 weeks of embryonic development. Approximately 12 weeks of embryonic development. The kidneys, the testicles, both the male testicle and the female ovaries, are with the kidney at the back where the kidney is, and they are covered by peritoneum, but not completely though. And they begin to descend. They begin to descend at approximately 27 or 28 weeks. They have arrived at the pelvic region. All right, let me stop this and then we'll